morning and welcome to AM Agenda. Some health experts are warning the government's overhaul of the hospital system could see smaller country hospitals forced to shut their doors. The Prime Minister this morning and his deputy on breakfast television have been arguing there should be no such concerns.
There is absolutely nothing in any one of the reforms that we would put forward in this plan that would cause any hospital in the country to close.
Health costs are going to get unsustainable if we don't act, and if that happens, boy, will you see hospitals close right around the nation.
Coming up on the program, I'll raise this issue with the Health Minister, Nicola Roxon. First, though, joining me on AM Agenda, the New South Wales Premier Kristina Keneally. Premier, thank you very much for your time this morning.
Thank you.
First of all, first and foremost, you are expected to support the Rudd government's overhaul. Can you confirm for us this morning that you will?
Well, we have a historic opportunity here. We should seize it with both hands, and that is to fundamentally reshape how healthcare is delivered. And after a decade of neglect by the Howard government, it's great to have a Prime Minister and a Commonwealth who want to take more responsibility for health. But we do have some very genuine questions, and we're putting those to the Commonwealth. Today I've written to the Prime Minister to outline some of those questions so that we can make the best decision in the interest of families and in the interest of the New South Wales taxpayer.
Okay, what are the questions? What are some of those concerns?
Well, we want to understand the Commonwealth's definition of primary health care and what services they would be taking over complete funding responsibility for. We want to understand how hypothecating 1/3 of GST revenue fits in within the broader Henry tax review. And in particular, we want to know how these new funding and organisational arrangements will lead to better alignment between primary care, hospital care and aged care.
Wouldn't your calls for more information and more detail on this carry more weight if the New South Wales government actually spent the money that it's already allocated on health, actually on health measures, on hospitals? Because at the moment you don't.
Well, in fact, health is 1/3 of our state budget, and independent data shows New South Wales has the best performing system in the country. We lead the nation on emergency department performance. We lead the nation on elective surgery. We have the highest paid nurses in the country. Now, we know, though, that fundamental change is required, and it's required because we have a growing population, we have chronic disease, and we have growing costs. If we do nothing, the New South Wales budget will be entirely consumed by health by around 2046, and that's why we welcome this historic opportunity to work in partnership with the Commonwealth. Today we're seeking genuine information to genuine questions.
Why then, if you say the New South Wales system leads the country, why is there a perception widely held in this country that New South Wales and its hospital system is dysfunctional?
Well, I've seen some commentators try to suggest that the Prime Minister's applying a Victorian solution to solve the New South Wales problem. The independent data, the Australian government's own data, the Australian Institute of Health and Welfare's data shows that we have a good health system, indeed leading the nation when it comes to emergency departments, when it comes to elective surgery. We have more beds per 1,000 people than Victoria, and we do a better job of treating people outside the hospital system where it's more appropriate and less costly than Victoria does.
Premier, during the week I spoke to the AMA President, Andrew Pesha. He works in New South Wales. He said that it is the worst, that anything would help the New South Wales system. What do you say to the doctors' groups then?
Well, what we say is we know that health is a growing demand that will devour everything that we do as a state government unless we have this fundamental change. And that's why it's so pleasing, after 11 years of the Howard government that reduced health funding and that refused to work in partnership, to have a Commonwealth Prime Minister, a Health Minister who's willing to sit down and talk to the states about fundamental change.
The money under this system is going to be provided on an activity basis, an activity model. Are you concerned that some of your country hospitals in New South Wales might be forced to shut down, as the Daily Telegraph is reporting this morning?
Well, one of the questions we put to the Commonwealth today is how does that role of independent umpire work in setting the efficient price per service? Will states and territories have a role in that? Will there be weighting for rural and regional parts of the country and the different circumstances in different states? We also want to know how this local hospital network will work when a hospital doesn't meet that efficient cost per service, or when a hospital is not meeting its budget.
Well, that's an interesting point, because it is going to be funded on an efficient price for a particular procedure. That's the way that the funding is going to be done. Now, are you confident that New South Wales and its system is efficient enough to not lose any money under this model? Because if you're not efficient, it seems that you would potentially be losing money out of your system.
Well, again, much has been made about the supposed efficiency of Victoria versus New South Wales, and while the cost of an average cost per patient in New South Wales is around $4,190, in Victoria it's around $4,002, the difference is that Victoria treats about 19% more people per 1,000 in the hospitals than New South Wales does. So we do a better job of treating people in a less costly manner. But it does come down to that key question. For some rural and regional hospitals, for some smaller hospitals that might struggle to meet that efficient cost per service, how will that cost be weighted, and what will be the impact, and who will be responsible when that efficient cost isn't met?
Premier, appreciate your time. I'll be putting that very question to Nicola Roxon in a moment. Thank you for joining us on AM Agenda.
Thank you.
Joining me now on our Friday morning panel, former Liberal leader John